So if you're a lady watching this and you've had multiple IVF cycle failures, here are some additional tests that I strongly recommend that you perform before going for your next IVF cycle. The first is a hysteroscopy or a saline sonogram. This helps to check if there are any polyps, adhesions, aka scarring, if there's any uterine structural abnormalities, all of which can get in the way of the implantation of the embryo. If you are suspected to have an autoimmune condition or blood clotting disorders, ideally you should have an immune panel and or thrombophilia testing. In a video I did about the rare causes of IVF cycle failures, I have described how autoimmune condition and blood clotting disorder conditions can interfere with IVF cycle, or should I say embryo implantation, leading to IVF cycle failures. So if you want to know more and in details, make sure you go ahead and watch that video after you finish watching this one. And finally, an additional test I would recommend that you do is karyotyping. This checks for rare genetic issues in either partners. So it doesn't just test for the genetic abnormalities within the egg or within the sperm, it actually screens the individual for any genetic abnormalities that they may have that will inevitably affect the gametes, and that means the eggs or the sperms that individual produces. Now, do not go and ask your fertility specialist to do all of these tests for you. That is not going to be necessary, just simply because not all of these tests are going to be relevant for you. Sit down once again and discuss with your fertility specialist. And with the information and the knowledge that you have now, speak to your fertility specialist and ask which of these tests are going to be more relevant for you.